So many of you have sent me Jim Carrey to review and analyze, and so here we go. He's one of the most expressive faces in Hollywood, and now his look is under scrutiny. Many of you have noticed some differences over the last few years, but let's examine Jim Carrey's facial evolution from the very beginning, and let's see if the changes can be attributed to just aging or if they're a sign of something more. As always, the total cost of potential procedures will be presented towards the end of the video. In 1981, at the age of 19, what I see is that Jim Carrey has a centrally based hairline part. You can see where the hair flows more to the right, and then it transitions to flowing more to the left, right around the middle of the hairline. He also has low-set, flat brows. Jim Carrey has a prominent orbicularis oculi muscle right here by the lower eyelid. He also has full tooth show when he smiles. And of course, as we all know, he has that nice, prominent, strong chin. In 1982, at the age of 20, what we see here is how highly expressive Jim Carrey is, and what makes him such a master in the various roles that he's played. And this is partly why we all love Jim Carrey. In 1984, at the age of 22, what I see is that Jim Carrey's lowest horizontal third is also his longest when it comes to the various facial segments. He has a fairly narrow nasal bridge as well as his nasal tip. In 1985, at the age of 23, Jim Carrey has what looks to be a possible scar at the left lower eyebrow. He also has a thin upper lip. And when we look at his cheeks, what we see is that there's limited cheek volume, and he has a flatter lateral cheekbone structure that becomes relevant later in this video. In 1988, at the age of 26, what I'm seeing here are well-defined philtral columns, as well as a relatively short philtrum. As you know, part of what I do for a living is shorten the philtrum for people where that philtrum is longer, or if they're looking to increase the volume of the lip or to increase upper tooth show. Some guys do present for lip lift surgery, and I find that a very small percentage of them are actually good candidates. Jim Carrey, for example, would not be a good candidate because of that already shorter philtral distance, as well as the upper tooth show that he already has. In 1990, at the age of 28, I'm seeing here that Jim Carrey has some upper eyelid laxity, and that excess skin does mask the supratarsal show. In 1991, at the age of 29, what we see is that Jim Carrey has a loss of his baby hairs in the frontotemporal corners. A common request that I get from guys coming to me for improved hairlines is that they're trying to regain that curvature that once existed. But what I tell them is that by the time people reach their 20s, that curvature is almost always gone, and there will be this natural frontotemporal corner or some degree of recession, and reproducing that is actually much more natural than artificially creating a very strong curve, which is actually a more feminine design. In 1992, at the age of 30, I see no change. And in 1994, at the age of 32, what I wanted to point out here is that Jim Carrey has strong temples. You can see his anterior temporal peak, and you can see how nicely that temporal area comes up and connects to the rest of his hairline. In 1995, at the age of 33, what we see here is that Jim has highly defined cheek folds, and that of course goes along very well with his expressive nature. And again, keep this in mind because it becomes more relevant with some of the more recent years and some of the changes that we now see, and how it takes away from that very expressive lower cheek area that we're so used to seeing with Jim Carrey. In 1996, at the age of 34, I see no change. And in 1997, I also see no change. In 1998, at the age of 36, we see that Jim now has more forehead rhytids or wrinkles forming. He also has infraorbital hollowing that is starting to increase with the aging process. And his cheek volume appears to be somewhat deflating, very gradually, but you can see that the cheek does look flatter compared to prior years. In 1999, at the age of 37, I see no change. And in 2000, at the age of 38, we see those very prominent forehead wrinkles, so there's definitely no Botox at this point. In 2001, at the age of 39, we see that Jim has slightly deeper frontotemporal recession. He overall has a well-preserved hairline, but of course the corners tend to recede as we age. And one of the key things that helps prevent that process and helps people prevent further hair loss around their entire scalp is finasteride. Remember, finasteride blocks the conversion of testosterone to dihydrotestosterone. DHT is the stronger version of testosterone that binds to our hair follicles in those DHT-sensitive zones and causes miniaturization and hair thinning over time. So a lot of guys will start on finasteride to prevent further loss of hair. And one of the common places where they're getting the finasteride is at feelconfident.com, because you fill out a questionnaire, and as long as there are no contraindications in that questionnaire, the medication is essentially sent to your door. And this is available in the United States, and it's a very convenient way of getting finasteride. And before you go and make fun of me, I have an autoimmune type of hair loss, alopecia areata. I had universalis at one point, and now I have some spontaneous return of some hair. You could see some eyebrows, some mustache. Some patients find it really funny that I'm growing out my mustache, but why not? I have it now, so I'm gonna flaunt it. But yeah, I've made videos about that many times, but I still get the comments about why is this guy with no hair talking about hair loss. In 2002, at the age of 40, I see no change. In 2003, at the age of 41, we see that Jim Carrey's crow's feet are starting to settle in more. So those lines are becoming more obvious and a bit more etched in. In 2004, at the age of 42, now that Jim Carrey has shaved his head, we can really see where his hairline is and its exact configuration. And you can see from this top-down view that Jim Carrey's nasal tip has some degree of deviation. And in 2005, at the age of 43, I see no change, and that's the same through 2007. In 2008, at the age of 46, we're seeing here the glabellar rhytids, or wrinkles, right here between the eyebrows. They're becoming more pronounced, including the horizontal crease that you see here. And that is where the procerus muscle lives. Remember that the lines form perpendicular to the fibers of the muscle that lives beneath. So the procerus muscle runs like this, and then that's why you see this horizontal line. So when people are doing Botox injections for the glabellar area, in addition to targeting the corrugator muscles where those 11s form, it's important for some patients to also target the procerus muscle so that you can reduce that horizontal line. Again, not everyone wants to get Botox, and that's all well and good. But if someone is getting Botox, you have to keep these muscles in mind. In 2009, at the age of 47, I see no change. And in 2010, at the age of 48, we're seeing here that Jim Carrey now has increased frontotemporal recession. And this is occurring as the temples themselves are starting to thin, and they're starting to get more concave. As that happens, the corner begins to open up more. So when we're doing hair transplant surgery at the hairline, one common thing that we do in my practice is that we start to incorporate the temples whenever possible to improve that configuration and that contour to a more natural, rejuvenated state. Now, that is a difficult type of transition to follow for many surgeons because the angulation and direction is changing quite a bit. I have an entire video on how we restore the temples. For anyone interested, go check that one out. In 2011, at the age of 49, I see no change. In 2012, at the age of 50, I also see no change. In 2013, at the age of 51, what we see here is that Jim now has increased upper eyelid redundancy, as the brows have descended and there's more skin laxity forming in the upper eyelid area. That tends to weigh down on the eyes, and in addition to reducing the supratarsal show, for some people it gets so severe that some of their vision can actually be blocked with all that extra skin. And that sometimes will actually lead to a patient getting a brow lift and or upper blepharoplasty to improve their vision. It's not always just for cosmesis. Sometimes it's just for these functional reasons, and in those situations, insurance will sometimes pay for those procedures. In 2014, at the age of 52, we're seeing here that Jim has increased submental fullness, especially when we compare back about 10 years to him at age 43, where now you can really see that there's just more going on in the submental space compared to him in his 40s. In 2015, at the age of 53, in addition to sporting this wonderful beard, the only other change that I'm seeing in Jim's face is that from the aging process, he has some increased temporal hollowing. So that's the area here, lateral to the orbital bone, that's starting to thin out a bit. And in 2016, at the age of 54, I see no change, and that's the same through 2024. We have a great newsletter available at feelconfident.com, so if you haven't signed up for it already, please make sure to subscribe to the newsletter so you can stay up to date on all the latest hair science, hair restoration news, as well as facial plastics updates. Oh, and make sure to try our brand new scalp serum if you haven't already. In 2025, at the age of 63, let's go over a few different areas and features of Jim Carrey's face and figure out where there might be a change. So when I look at the hairline, I'm really not seeing any changes. Next, the rhytids or the wrinkles of the face. To me, they look very similar, so again, no change there. When we assess the brows and the eyelids, I think they're in the same general position and have the same amount of skin redundancy as they did prior. So again, no change. Next, in looking at the lips and the chin, to me, they look about the same, so no change there. But something looks different about his face compared to even 2024. What might it be? Well, in looking at the cheeks and the temple area, to me, they look fuller. And that is likely the result of filler to those areas. And the biggest issue to my eye is that the filler that may have been placed was built up a little too much medially, so closer to the center of the face, as opposed to being spread out more evenly across the cheek, and even better would have been more emphasis on the lateral cheek. But because the medial face was built up more, you can really spot a very obvious difference compared to years prior. And even when you look back at Jim Carrey at age 19, there's a bit more of a balance in the degree of fullness across the cheek. It's not so heavily centered just on the medial cheek itself. But with the addition of what I think is filler, there's now a lot more attention on this area here. And in 2026, at the age of 64, to me, it looks like there have been some additional changes to Jim Carrey's face. I think that there are signs of a brow lift. When you look at his hairline, it appears to be higher, and that's sometimes what a brow lift leads to. In addition to the scarring that you might have from a brow lift, it can also increase the top third of the face as the hairline is brought up. And of course, it could be just a sign of aging, but for him to have a fairly fixed hairline for so many years and then just kind of overnight have a higher hairline is just unlikely. So that to me also just indicates that this may have been a brow lift. And the brows just look more lifted. The eyes look more open, the brows look more lifted compared to even him at age 19. In addition to the brow lift, I think he may have had an upper blepharoplasty. This is because I'm seeing some increased supratarsal show, and again, his eyes appear more open than they did in previous years. Look at his smile here at age 64 and compare that back to age 19. You can see that things look more open than they ever did for him. Also, I think that Jim Carrey may have had a facelift with or without a fat transfer. Look how smooth his jawline appears now. Also, to my eye, it looks like the sideburns have shifted up, and that level of distortion is what we see with some facelifts, where sometimes the tragus appears flatter and larger, sometimes the sideburn is pretty much taken off with that lift. And some patients actually come to me for a hair transplant after a facelift to try to restore their sideburns and to cover up some of the scarring with hair. Remember, with a hair transplant, it's not just the masking of the scar with hair, it's also the remodeling of the scar that we see once those hairs are growing in the scar. All that new blood flow to the scar leads to an improvement in the quality of it. So that's something to keep in mind. Also with Jim Carrey, we're seeing that his cheeks now look fuller. So when a facelift is done, the cheeks tend to gain volume, especially in that lateral cheek. He may have also had a fat transfer for even more volume, and his skin quality now looks improved. Remember that with a fat transfer, you're bringing in some fat stem cells, and those stem cells tend to rejuvenate the skin quality. But also with facelifting, sometimes laser resurfacing is performed, sometimes a chemical peel might be performed around the same time to further improve the quality of the skin. The total cost of these potential procedures for Jim Carrey is $165,000. What do you think about Jim Carrey's transformation? Are his looks all natural, or has he had a little help from plastic surgery in recent years? Let me know what you think in the comments below, and please make sure to subscribe to my channel. Thank you.